Okay, I wanted to briefly talk about small intestine 9 and small intestine 10 in terms of needling them. I'm going to be speaking more about the psycho-emotional aspects of these points in another video. But I just wanted to point out the relationship between 9, 10, 11, 12, 13, 14, and 15. These are points along the small intestine channel that zig and zag, a little bit like the gallbladder channel, across the upper back and the shoulder. And these are outstanding points, and I would say almost necessary points when you're treating anyone with not just physical concerns, but psycho-emotional concerns that are manifesting on the body level. And so here we see small intestine 9, which is just above the meeting of the axilla, the lower border of the axilla. And then we see small intestine here, which is just under that corner, the very posterior corner of where the scapular spine and the acromion meet at the head of the humerus, which is this bone here. And these points have a lot to do with the mobility of our shoulder, the ability to abduct and adduct the shoulder, to lift the arm, to reach out and extend. Taiyang in particular, both the small intestine of the upper body and the bladder of the lower body, have a lot to do with our ability to extend. So the bladder has a lot to do with our ability to extend this way, almost like getting up out of a chair. And the small intestine gives us the capacity to reach out and extend towards what our heart wants, right? We see something that captures our attention. It stimulates something in our mind, in our heart mind, that we desire. And so that could be on a physical level, such as food, right? Or this could be something on a more emotionally gratifying level. So that gives us the capacity to extend, to reach out the arm, right? And the shoulder is what mediates that, and the muscles around the scapula would help us to mediate that, as well as to grasp it and bring it back in, right? And that's accompanied by the lung and the large intestine. We'll get to that at another time. So it's interesting that there's a motor point actually between small intestine 9 and 10 for the teres minor muscle. And this is actually a very important muscle that's related to a lot of the small intestine meridian's functions, as well as on the small intestine sinew channel. Okay, so when I'm needling these points, I'll often do these two together. I'm going to talk about the rest of these in some following videos, but small intestine 9 and 10, I often do as a pair, true shoulder, Janzen, right, upright shoulder, and the shoulder blade shu. I often do 11 and 12 as a pair, and then I often do 13, 14, and 15 all together, which I'll talk about very shortly. So 9 and 10 are fantastic points to do together at the same time, especially with electric stimulation at a very microcurrent level. And you can also do these points to help release cold and wind cold from the muscle layer, as well as the deeper muscle layers or the surface fascia layer. And you can do that by needling these points perpendicular into the muscle, right, relatively deeply. And then we can put moxa on top of the needle there and burn that 3-4 balls of moxa so the patient can feel the heat penetrating into this area. So this is really good for any time when the person has difficulty extending or even lifting their arm, or in severe cases of frozen shoulder.